Gestational diabetes is really important to pay attention to because it's one of the most important risk factors for diabetes. So women who get gestational diabetes, they usually get elevation in their sugars only in the last part of their pregnancy. And then over 90% of these women, when they deliver, the sugars go back to normal. But it is not a normal change for pregnancy. Only about 5 to at most 15% of women, depending on what part of the world you're in, get gestational diabetes. So majority of women, their sugars actually don't go up with pregnancy. And so the ones that go up, for them is a red flag. They should know that they have, most probably they've inherited some gene for diabetes, most probably they have some family history for it, and they have up to 30% risk of becoming a diabetic patient later in life. And so it's really important to, even if it goes away and you have to do nothing after, with regards to medication after treatment, it's important to remember the history, to share it with your physicians later so they know they can screen you more for diabetes. It's also important to remember that if you lose the weight from the pregnancy, and again, if you go back to the diabetic lifestyle that we talked about, they can also prevent getting type 2 diabetes. The third thing that's really important with gestational diabetes is that the children that are born to mothers with gestational diabetes, so the child that they had high sugars with, that child has a higher risk of becoming an obese child in life and also has a higher risk of getting diabetes. So if a woman had 2 children and one without gestational diabetes and one with, the child that's going to get diabetes or has a higher chance is the one who was actually in the mother's womb when she had diabetes. And so children and fetuses, when they're inside the mom, they actually program their pancreas and learn how to manage sugar. But if you have an environment that has high levels of sugar, they don't program well. Basically, that's what the cause is. And then later in life, they can have diabetes. So another thing as a parent that you can do with gestational diabetes is to work with the children and get them active and get them into a good lifestyle from very young age. And it's been shown that this can really change the path for them for getting diabetes. So not everybody gets it. It's the ones who have bad, not the best lifestyle, the kids who don't eat the best diet, and who are sedentary and sit in front of the computer all day. You want to get them out and get them into sports.